welcome to another ASRF members video. I'm here with one of my favorite people on the planet, Dr. Monique Andrews. And look, what a year it is to be talking about the topic that we've got up our sleeve today, polyvagal theory. Dr. Mo, how are you and how did you get your teeth into this very meaty subject?
Thanks so much, Claire. Thanks for inviting me. I so much enjoy our conversations. So a lot of people don't know that I have an undergraduate degree in psychology, and my master's degree in neuroscience was also in biological psychology. So I've always had this very deep interest in the body-mind continuum. And so polyvagal is something that I've been interested in for many years. And it's a conversation I feel like we should have been having in chiropractic for a long time.
Now, polyvagal theory is kind of this evolutionary theory pertaining to the vagus nerve. So for the people who are like complete novices at this, just talk us about what that is.
Yeah, basically, Stephen Porges developed the polyvagal theory in the late 90s, essentially to explain why people behave the way they do from a neurophysiological perspective. And when he was in the late 60s, he was actually doing work in HRV at that point.
Wow.
And he and psychology at that time was very behaviorally focused. But he wanted to find a way to marry the neurophysiology to what the clinician was seeing in therapeutic practice.
Mm-hmm.
And so he developed polyvagal to try and bridge that gap.
Yeah. Now, it's an interesting gap for, I guess, chiropractors to be thinking about when we're thinking about modulating the stress response and we're thinking about the impact of the adjustment on the sympathetic nervous system. How does polyvagal theory fit into that whole kind of,
so here's the thing, right? Like, as chiropractors, we talk a lot about tone and modulating the tone of the nervous system.
Yeah.
And outside of looking at HRV or some other objective findings, we don't actually have a very good language or even demonstration of how we are actually impacting tone of the nervous system.
Yeah.
And I think polyvagal theory gives us a very unique lens into that. Mm-hmm. And maybe some languaging that we can start to use that is evidence informed.
Right. So give me an example of how this might look in kind of a practice setting, where you've got a practice member or a patient, or however you language that, who's come in, and we've got that high stress. We know that there's some indications that adjusting the especially the upper cervicals can impact on vagal tone or stimulate the vagus nerve.
Sure.
But how do we work this into the conversation in practice, and how do we measure how it affects the patient?
So I think there's a few components to that answer. And first of all, I would say that number one, we can acknowledge, especially in 2020, that everybody's stress levels are very high. I think we all have maybe we're operating a little bit more of a sympathetic perspective, right? Yeah. And so polyvagal theory, there used to be, the idea was, and in fact, it's still largely accepted in medicine and a lot of disciplines in science, that the autonomic nervous system only has two branches, sympathetic and parasympathetic. And what Porges has offered is that actually the parasympathetic is divided in two. And so people can show up in various states, right? The way polyvagal theory works is that there's a hierarchical perspective on how we navigate through our physiology. Let me explain that a little more simply. Everything that happens in your environment, inside your body and outside your body, your brain is constantly surveilling. Is this safe? Is this not safe? It's something that Porges calls neuroception, which is one of the primary tenets of polyvagal theory. And so whenever your response to your environment is a physiological process, it's precognition. It's not like you decide, oh, I'm going to rev up my sympathetics. It's literally your brain decides based on past experience and current situation how your body's going to respond. Right now, people's bodies are responding in a high degree of sympathetic, and I think that's something that we can acknowledge in our practice.
Yeah.
And when people come in, besides the adjustment or in addition to the adjustment, I think we can help prepare the nervous system for that yet another introduction of force into the body, into the being.
Okay. So tell me more about what you mean is by yet another introduction of force. Is that the adjustment alone? Is that the clinical experience in the practice? Is that,
Yeah. So one of my mentors, who's passed now, Dr. Sue Brown, she used to say that every experience that we have is taken as a force into the body. And we either can take a force and we learn and grow from it, or it gets stored as potential energy or as subluxation.
Mm-hmm.
And so if we introduce a force into the body by way of the adjustment, the idea is that the body's going to take and use that constructively.
Yeah.
What I'm suggesting is that we can actually use polyvagal theory to help attune the nervous system to better be able to accept that force. And by using polyvagal exercises, so we just taught a course in applied polyvagal for chiropractors.
Yeah.
By using polyvagal exercises, we can actually elevate the parasympathetic nervous system to make the system more receptive.
Okay. So, all right, that's interesting. Now, I guess this is kind of harking back to a little bit of an anatomy kind of question for those kind of students that are watching going, polyvagal theory, what? So I've heard words like dorsal vagal, myelinated vagus, unmyelinated. Poly obviously means many, but there's only one vagus nerve. So talk me through that.
So Porges divided the vagus. Well, he didn't divide. Evolution divided the vagus into dorsal vagal and ventrovagal. Now, first of all, because we have students and maybe a few other people that need to brush up on their anatomy, 80% of vagus nerve fibers are actually afferent. That's information coming into the brain. The other 20% are efferent, and these are divided into ventral vagal and dorsal vagal. Ventral vagal, coming from nucleus ambiguus, is actually myelinated, a myelinated efferent, very fast, called ventral because it's in the ventral part of the brainstem.
Yeah.
Dorsal vagal is that unmyelinated efferent, and it's coming from the dorsal motor nucleus, which is in the dorsal part of the brainstem. So there's your ventral vagal and dorsal vagal. Mm-hmm. Now, anatomically, dorsal vagal is predominantly subdiaphragmatic, meaning it innervates a lot of the digestive organs of reproductive below the diaphragm.
Right.
Ventral vagal is that motor nucleus that innervates supradiaphragmatic systems. So heart, lungs, and muscles of the face, inner ear that actually help control tone of sound, eye muscles, facial expression. And it's why ventral vagal is called the social engagement system.
Okay. Social engagement system. Bloody interesting in a year where social isolation has perhaps been the hallmark of this moment in history. So that must have a lot of impact on that's just a thought. What do you think about that?
Right? So here's the thing, is that as human beings, our highest need is connection. Mm-hmm. And how we have connection is through our social engagement system, through that ventral vagus pathway. Mm-hmm. Because what happens, and this functions from an evolutionary perspective, because we go literally how we experience the world is through those three hierarchies of our autonomic nervous system. So the first thing we do is we engage. Is this person look friendly? Are they smiling? Oh, hey, look at their face. That's friendly. That's social engagement. It's actually how we connect.
Yeah.
So what happens then if you put a mask on?
Yeah. You're not
and
safe.
You can't see. Guess what it does? It actually, without you having any conscious awareness, it lowers the tone of the nervous system and it drops us into sympathetic. So we're already in a heightened state of stress. You remove our ability to connect by putting a mask on the face, and so we can't see our social engagement system. What happens? Yeah. We drop into sympathetic.
Wow. Do you know, I was thinking that the other day when I was trying to make this baby smile ahead of me in the post office queue. And I was like, oh my gosh, I must just seem like a creep because all you can see is this. Okay, so in a year like this, and you know, we're looking at the possibility of masks being mandatory in a lot of places for a long, long time. And we can not exactly tell people to go against, go against the advice of the system, but how do we kind of counteract that effect on the sympathetic nervous system? I mean, obviously we can check and adjust for subluxations. Obviously, we can stimulate the vagus nerve through upper cervical adjustments. And I was interested to see on your page, Dr. Mo knows just a little bit of a illustration on what a subluxation in that upper area is going to do in terms of the vagus. But what else can we do as chiropractors to kind of impact into that sympathetic state that people are?
You know, we work with a lot of doctors through the Prana Foundation, and my wife and Prana Foundation co-founder, Dr. Tamara McIntyre, has created a whole course teaching chiropractors how to do their initial intakes virtually, so that their very first experience with a new patient, a new practice member, is if they do it via an online portal, then they can actually see each other's face. And what we've been finding, the results are amazing, because it allows you that experience that you can connect face to face. The patient is at home, they're much more comfortable in their own environment to have this conversation. You might have that, right? So you could do the initial intake in history, actually seeing somebody's face. They can get to see you and know you. They get to see your facial expression. We have that level of social engagement, that, you know, connection, prefrontal cortex to prefrontal cortex. And it's had a very calming effect. So number one, starting from that place. And in fact, we've worked with a number of Australian chiropractors when the lockdown first hit in Western Australia, to quickly get them ready to be able to start to navigate that patient encounter virtually.
Yeah, that's amazing. I actually, because I've just moved to Melbourne myself, I just went to a new chiropractor this week. And it was so funny because I went for the first time on Monday. And the second time I went back and he's like, oh, you've got new jeans. And I'm thinking, oh, gee, I only just met this guy and he's noticed my new jeans. No, I'd left the sticker on the back that had listed the size, just running right down the back of my, so that was fantastic. But anyway, those moments of connection, I feel noticed, I feel seen. Oh, rubbish. Anyway, so in terms of the way people check and adjust, like that doesn't really need to change a whole lot in order to work with this idea of vagal tone and of the polyvagal theory. Is it more in the affect and more in the considerations we put around the consultation and the engagement?
Yeah, I think so. Like I've always believed that, everybody experiences trauma in their life, and that trauma is not so much the event as it is a stored experience in the body. And something that we do as chiropractors is we release this stored trauma, this stored stress. In releasing subluxation, we're releasing past experiences. And that can also be very traumatic for the patient. And I think some of it is really just acknowledging that this is the way the body works and this is our approach. And I think if we can start to talk about the nervous system, it also helps us to move the conversation away from like back and neck pain, for example. So it really helps to shift the narrative in our conversation. I don't think you necessarily have to like change anything that we're doing in terms of the adjustment. In fact, that's not what I'm suggesting at all. I'm saying it's an acknowledgement for this physiological process that's happening in the body. And in fact, maybe allows us to be a little bit more compassionate for people in the way that they respond to anything that happens to them in their life, really.
That's interesting. I think compassion needs to be a huge consideration as we work into, I think, a long-term recovery from the year that has been. And, different people are going to kind of manifest that stress in all sorts of different ways, but compassion's got to be one kind of marker of how we move forward. And I think chiropractors as a rule are pretty good at that. I think another thing that is currency is definitely research. So I know this is a big question when we've been talking about a giant like Porges, but where do you think polyvagal research and chiropractic research needs to go in this area in the future?
Yeah. So something that I've been talking about quite a bit, obviously, is our potential impact on the vagus nerve. And there have been, there's 20 years at least of research now and hundreds of articles showing the impact of vagus nerve stimulation on things like inflammation and the immune system, and studies looking at not just the fact that when you stimulate the vagus, you reduce inflammation, but there are now studies that show even with transcutaneous vagus nerve stimulation, so literally stimulating from externally, usually it's the afferent branch
Yeah.
of the vagus nerve through the ear, that it doesn't just decrease inflammation, it down regulates pro-inflammatory receptors for cytokines and chemokines. This is a big deal because we're actually talking about genetic change, right?
Wow.
That
Okay.
science already exists in other disciplines. It does not exist for chiropractic, and that's where we need to go.
Right. Okay. Now, cytokines I've heard of. Chemokines, what are they?
Yeah, again, we're talking about it just as different subclass of this from the same family.
Yeah.
So there are different pro-inflammatory markers and then these teeny tiny little proteins, and they just get categorized differently.
Yeah. Wow. Okay. So there's a whole lot in this, and it would be, it's really a good time to be involved in chiropractic research, I think, as we start to look down this particular area. I mean, I've heard of vagus nerve stimulation being used to treat epilepsy and stuff like that. But yeah, I mean, restoring that sense of ease and of wellness and of being okay after long-term stresses is a big thing too.
Yeah, and we're able to demonstrate that using heart rate variability that we're impacting tone. And I think we could, really go deeper into that realm. And we need to, with so much research, some of the small amount of research that we have with heart rate variability in chiropractic, that needs to be expanded on, that needs to be replicated. We need to see more. But we have some really great glimpses into what's possible. And I think we just, we have the problem we always have in chiropractic. We don't have the money or the resources. And it's why we need to support organizations like ASRF, because we need more funds to do the work so that we can put our money where our mouth is, and actually back up what we're saying.
Yeah, and that's what floats my boat. That's what gets me out of bed in the morning. So it's love, and of course, talking to a neuroscientist like yourself, it's always going to float your boat too. What's next for Dr. Mo and Dr. Mac, and what's next for the Prana Foundation?
Wow. So, like I said, we just launched this course and we had people from 5 continents take our course. We spent last Saturday morning with about 40 students from as far away as South Africa, Chile, Australia, the UK, Canada, all over the US. And we're already planning a follow-up to that to go deeper into it. I'm always developing my Dr. Mo Knows program. Series 4 is about to start in January, and I'm kicking that off with a deep exploration into chiropractic and the immune system.
Amazing. Love it. Thank you, Dr. Mo, for talking to us today, and we can't wait to see what emerges next.
Thanks so much, Claire. Always, always a pleasure speaking with you.